Medical tests
by Thea
and Bennett Joseph.
What is an EMG?
EMG stands for electromyogram, and it shows the electric activity in your muscles as they contract.
The bigger the spikes, the more muscle fibers are being used.
EMG results can reveal nerve dysfunction, muscle dysfunction, or problem with nerve-to-muscle signal transmission.
This is an EMG scan of my arm.
What is an ECG?
An ECG stands for electrocardiogram. It shows the electrical activity from my heart when it beats.
It is used to help diagnose and monitor conditions affecting the heart.
It can be used to investigate symptoms of a possible heart problem, such as chest pain, palpitations, sudden noticeable heartbeats, dizziness, and shortness of breath.
If you count the tallest spikes on Thea's graph and multiply it by 12, you know how many times her heart beats per minute.
What is phlebotomy?
Phlebotomy is a process of making a puncture in the vein, usually in the arm, with a cannula for the purpose of drawing blood.
The most effective angle to draw blood from is at 45 degrees.
It's an important tool for diagnosing many medical conditions. What is a reflex?
A reflex is an involuntary and sudden response to stimuli. Doctors test your reflexes to help determine how effective your nervous system is by assessing the reaction between your motor pathways and your sensory responses.
During the test, your doctor may tap your knees, biceps, fingers, and ankles.
But did you know you can also test your reflex in your eyes as well?
It is called a pupil reflex. Doctors use it to test whether a patient's eyes are functioning normally.
Abnormal results may indicate any number of problems. Some of these include an abnormally sized or shaped pupil, optic nerve damage, or other neurological concern. What is an infrared vein scanner?
Near-infrared vein finder are devices used to try to increase the ability of healthcare providers to see veins.
The use of a vein finder would help the phlebotomist to easily locate the vein, preventing possible pre-analytic error in the specimen collection and even more discomfort and pain to the patient.
What is a pulse Doppler?
A pulse Doppler sends short pulses of ultrasound and analyzes reflected sound waves between the pulses.
A Doppler test is used to detect blood flow.
It shows whether a pulse is present and whether there is blood flow to the limb.
It can diagnose or help to manage conditions such as peripheral arterial disease or diabetic foot ulcer.
What is an ultrasound?
An ultrasound scan, sometimes called as a sonogram, is a procedure that uses high-frequency sound waves to create an image of part of inside someone's body.
Doctors use ultrasounds to detect changes in the appearance of organs, tissues, and vessels, and to detect abnormal masses, such as tumors.
In the ultrasound exam, a transducer both sends the sound waves and records the echoing, returning waves. Colorblind test.
Here's the first one.
What number can you see?
You have 3 seconds to say the number you see. 3, 2, 1.
The number was 74.
Here's the second one.
3, 2, 1.
The number is 6.
Here's the third one.
3, 2, 1.
The number was 15.
Here's the fourth one.
5, 4, 3, 2, 1.
The answer was 16.
Here's the fifth one.
3, 2, 1.
The number was 97. Thank you for watching.